Acalabrutinib received its first approval in mantle cell lymphoma, and the overall efficacy comparing across studies in mantle cell lymphoma looks very similar to ibrutinib. Chronic lymphocytic leukemia is considerably more frequently diagnosed, managed, and so forth, so CLL is a larger population. And as of yet, we don't currently have FDA approval for ibrutinib amongst those patients. We don't have approval for acalabrutinib in CLL. Now, that's going to change. There are 3 pivotal studies out there. In the relapse setting, we have just seen data at EHA where ibrutinib beat investigators' choice of bendamustine rituximab or idelalisib rituximab. And so that should lead to approval of CLL in the relapse setting. And then there's a press release available that states that in a frontline study of acalabrutinib versus acalabrutinib obinutuzumab versus chlorambucil obinutuzumab, that study also met its primary endpoint. We don't have the data on that yet. So I do anticipate that we'll get approval for acalabrutinib in the frontline setting. Whether or not it differentiates itself from ibrutinib will then be answered in the 3rd pivotal study, which is actually a head-to-head pivotal study of acalabrutinib versus ibrutinib. And that study probably won't read out for quite some time, but will be very important for the field.